Retinol can transform your skin or it can destroy it. I have seen both sides. In over 20 years of prescribing retinoids, I've watched patients go from dull, aging, acne-prone skin to completely transformed complexions. I've also seen people burn their skin barriers, trigger months of purging, and set their skin back significantly because they started wrong and did it wrong. Today, I'm making sure you do it right. If I could only recommend one skincare ingredient to every adult over 30 years of age on this planet, it would be a retinoid. No hesitation, not because it's trendy, not because it's new, because after decades of research, we're talking studies going back to the 1970s. Retinoids are the most evidence-backed skin active ingredients in all of dermatology and healthcare. Full stop. Nothing else comes close in terms of the breadth of indication and the depth of evidence. But, and this is a significant but, they are the most misused ingredient I see. People start too strong, jumping straight to 1% retinol or buying prescriptive Tretinoin because a friend told them that and using it without medical supervision. Too often using it every day, from day to night, all the time, when their skin has zero tolerance, layering wrong things on top, vitamin C, AHAs, BHAs on the same time, and then they suffer redness, peeling, purging, burning, and then they quit. And then they come out saying, retinol doesn't work for me. It does. You just never gave it the right start. Today, the complete guide from someone who's been practicing using retinoids for over 20 years. Here's what we're covering. 1. What retinoids actually do at a cellular level, because understanding the mechanism means you'll actually stick with it through the initial phase, the purge. 2. The hierarchy, retinol, retinal, tretinoin, the difference, who uses what, why, and why you probably shouldn't start what you think you should. 3. Exactly how to start the build-up and avoid disaster reactions, step by step. 4. My specific product recommendations at every price point in India. By the end, you'll have a complete retinoid roadmap. Let's start with the science. What retinoids do inside your skin? Retinoids work by binding to the nuclear receptors inside your skin cells, specifically retinoic acid receptors or RARs, RAR, and retinoid X receptors, RXRs. And when they bind, they act as gene temptation factors. They change which genes are active inside your skin cells. This is not surface level chemistry. Retinoids work at the level of gene expression. 4 things happen at a cellular level. 1. Cell turnover speeds up. Your skin is constantly shedding and replacing cells, and this slows as we start aging at 25 years of age and above. Instead of every 28 days, it can become 45 to 60 days in a 50-year-old. Retinoid hits the accelerator, shedding dull skin faster, resurfacing the fresh skin cells quickly. This is why we look brighter within 4 to 8 weeks. 2. Collagen production is stimulated. Retinoids directly signal the fibroblasts, the cells that produce collagen, to ramp up the production. More collagen means firmer, plumper skin and fewer lines and wrinkles. This is anti-aging mechanism and it's measurable. Studies using ultrasound and confocal microscopy actually showed increase in dermal collagen density with long-term retinoid use. 3. Skin cell production inside pores normalizes. One root cause of acne is abnormal cell shedding inside the follicle. Cells clump, trump oil, and provide a food source for the C. acnes bacteria. Retinoids normalize this process. This is why I include retinol in almost every acne patient's routine. It's not just anti-aging, it's anti-acne too. 4. Melanin transfer is inhibited. Retinoids reduce the transfer of melanin from the melanocytes, the pigment cells, to the surrounding keratinocytes or the skin cells. That's why they're powerful for hyperpigmentation, dark spots, post-acne marks on Indian skin. 1 ingredient, 4 proven mechanisms: anti-aging, anti-acne, reduces pigmentation, and skin cell renewal simultaneously. This is why, after decades, dermatologists keep coming back to retinoids. Nothing else does all these four simultaneously with this depth of evidence. The retinoid hierarchy. All retinoids are vitamin A derivatives, but they are not equivalent. And this distinction matters enormously for how you use them. Your skin can only use the active form, retinoic acid. Everything else is a precursor that your skin must convert through enzymatic steps. The number of conversion steps determines how potent and how irritating each form is. Retinol, which is OTC, over the counter, available everywhere in India, needs 2 steps of conversion to become active retinoic acid. It's the gentlest and the slowest. Takes longer to show the results, but significantly less irritating. Perfect for beginners, sensitive skin, and Indian skin types. But, tends towards post-inflammatory hyperpigmentation from irritation. Retinal or retinaldehyde. It's 1 step to the active, 11 times more potent than retinol at equivalent concentration. Also available as OTC. If you've tolerated retinol well for about 6 months and you want to upgrade without a prescription, Retinal is your next step. Brands like Medic 8, Avene have retinol formulations. They're less common in India, but they're growing. Tretinoin. This is already an active retinoic acid, 0 conversion. This is the gold standard, the fastest results, most potent. But wait, it's prescription only. So there are various brand names available at pharmacies, but you must use this with a prescription from a medical doctor only. It's not something you use randomly. Comparison table. Retinol, 2 conversion steps. Mild, OTC, 12 plus weeks for results. Retinal, 1 conversion step. Moderate, OTC, 6 to 8 weeks for results. Tretinoin, 0 steps. Strongest, prescription only, 4 to 6 weeks for the results. Tretinoin is not the starting point for most people. The initial reaction, redness, peeling, purging, is significantly more intense than in OTC retinol or retinal. And for Indian skin specifically, which is more prone to post-inflammatory hyperpigmentation from any irritation triggered by inflammation, a gradual approach matters even more. I've had Indian patients who've jumped straight to 0.5% Tretinoin from an overseas purchase and spent months managing the post-inflammatory hyperpigmentation aftermath. You start with retinol, build your tolerance, and then consider upgrading unless it's under medical supervision and guidance where your doctor is helping you build your resistance in the right way to Tretinoin. How to start the right way? Think of introducing retinol like training for a long run. You don't lace up on Monday and run a marathon on Tuesday or Wednesday. Step 1, start with 0.05% retinol. Don't start off with 1%, no matter what the product promises or what your friend says. It's right for them, may not be right for you. Too high, too fast equals the purging nightmare. It scares off people permanently. Slow and low wins. Step 2, use it twice a week only. To start, Monday and Thursday or a Sunday and Wednesday in the first month. Mark it in your calendar if you need it. 2 nights a week for 4 weeks. Your skin needs time to upregulate the enzymes that process retinol and adjust to the increased cell turnover rate. Month 2, if you're tolerating it well, increase to 3 nights. Month 3, 4 nights, eventually a nightly regimen. But for most Indian skin, 3 times a week is ideal, especially if you're under 40 years of age. If you're over 40 years, then you can ramp it up to every night use. And that's what separates the people who succeed with retinol from the ones who quit in a week. Step 3, apply to dry skin. Wait 20 to 30 minutes after cleansing. Wet or damp skin dramatically increases the retinol penetration and with it the irritation. The extra penetration is not giving you extra results. It's giving you a red peeling face. Step 4, moisturizer. After and always. Apply retinol, let it absorb for 2 to 3 minutes and then apply a moisturizer on top. Better yet, you can try the sandwich method. Moisturizer first, then the retinol after a minute, and then again a moisturizer after a minute. And the first moisturizer layer buffers the retinol, slowing penetration and dramatically reduces irritation, especially important for beginners. This is the method I recommend to virtually every new retinol user in my clinic, and I always ask them to use a ceramide based moisturizer. Step 5, no other actives on retinol nights when you're starting out. No AHA, no BHA, be it glycolic, lactic, salicylic acid. Each of these individually excellent, but together very potent, especially if you're using it on the same night and you're compounding the irritation without meaningful additional benefits. Step 6, SPF every single day. Retinoids increase photosensitivity by accelerating the cell turnover and presenting new, less UV adapted cells at the surface. Skipping SPF is a no-no when you're using retinol at night actively. It undoes all that you're working towards and risks PIH. The common mistakes. 5 mistakes I constantly see, even among people when they think they know what they're doing with retinol. Mistake 1, starting too strong, 0.5 to 1%. That's the way to go, not one right day one. Your skin isn't ready. The enzyme capacity to convert retinol isn't there yet. The irritation is not evident that it's working hard. It's evidence that you've overwhelmed your skin. You've damaged it. Start slower, 0.025, 0.5, 0.1%, and then go. Mistake 2 is applying on wet skin. The water increases the absorption dramatically, and so you have deeper and faster penetration. You're not getting better results, you're just getting more irritation. Always wait until the skin is fully dry. Mistake 3, using every night immediately. Your skin needs to acclimatize enzymatically twice a week, then increase it slowly. Mistake 4, stopping when you purge. The purge is real. It's an increase in the skin before it settles in. It takes 4 to 8 weeks to settle because the retinol is speeding up the cell turnover and pushing everything that's blocking the pores to the surface. So you can even have the breakout purge. Uncomfortable. Feels like the retinol's making your skin worse. For most people, it's not. It's just a temporary wave of clearance. And unless you have severe burning, raw skin, or genuinely compromised barrier, push through this purge. Your skin will clear significantly and it's better on the other side. Mistake 5, no SPF. I will say this every time. Every morning, non-negotiable, use the SPF. My product recommendations, well, for under 700 in the budget range, minimalist 0.2 retinol in squalene is a good value retinol product in India. It is honestly formulated, clearly labeled, excellent starting point. The Dermaco 0.1% retinol serum is another beginner option. Even lower concentration, even lower irritation takes longer for it to work. These are recommendations for starting points. Mid-range, Paula's Choice, the 1% retinol for those who've built some amount of tolerance and are ready to increase the potency. The Inky List retinol, it's a solid formulation with built-in barrier support ingredients. And for those who are moving towards the stronger retinols, the Medic 8 Crystal Retinol is a good range if your budget allows it. Prescription level, the Tretinoin is the molecule, and this is based on prescription only, available in pharmacies and must only be used under the guidance of a registered medical practitioner. This is not one that you just want to start. This is an upgrade conversion. You have to have your dermatologist guide you on this. What to expect on your retinol journey? The honest timeline. Weeks 1 to 4, mild dryness, possible flaking, it's normal. Moisturize well with ceramide-based moisturizers. Weeks 4 to 5, possible purge, increased breakouts temporarily. So this is a normal transition. Stay the course unless you have severe burning or have other skin issues. Month 3, clearer skin. The texture is beginning to improve. Pores are looking smaller. Month 6, visible changes in the tone, the fine lines, and the pigmentation. This is where patients start saying, my friends are asking me what I'm doing. Year 1 and beyond, this is where the magic really happens. The measurable increase in dermal collagen, significant pigmentation reduction, skin that looks genuinely younger and more resilient. Retinoids are a long game, but the payoff is real, documented, and unlike most skincare promises, actually supported by decades of clinical evidence. If you're on the fence, start this week. Lowest concentration you can find twice weekly, ceramide moisturizers, and sunscreen after every morning. That's all you need to do to get started. Next week, let's talk about sunscreen, the mistakes you make, your SPF completely ineffective even when you're applying it every single day. This one will shock some of you. Subscribe now if you haven't. Drop your retinol questions below. I'll answer as many as I can. This is Dr. Chytra and your beauty doc signing off.